Well, hello, free people of the Rocky Mountain region. My name is Brandon, and welcome to this Free State Colorado interview. The mission of Free State Colorado is to promote a culture of liberty, freedom of the individual, and a free market. Today, I'm joined by Pam Long, an Army veteran of the Medical Service Corps and one of the founders of Colorado Health Choice Alliance, which began during the 2020 COVID scare to protect the rights of Colorado families to live healthy lives without government intervention in medical choices. Well, Pam, I hope you are well, and thank you for joining me today.
Thank you for having me today.
Well, Pam, what got you interested in protecting medical freedom?
Well, Colorado Health Choice Alliance actually started way before COVID, about 10 years ago, 2014. This has been a long game to erode, restrict, remove exemption rights. And so about 2014, there was some legislation right here in Colorado. Colorado tends to be one of those states that will lead the way on some of these agendas, like with removing vaccine exemptions. And parents, about 70 parents, showed up at the Capitol and said, we would like to protect our exemption rights, and defeated that first bill in 2014, which would have required parents to go to some type of state-sponsored, state-written re-education module where you would have to have a doctor approve your beliefs and get permission from a doctor to exempt from any one vaccine. And from there, every year since 2014, there were bills to erode vaccine exemption rights. And so we grew from 70 people to what became pre-COVID, we were up to 30,000 people on social media across the state of Colorado. And we were able to defeat many, many bills because of just parents waking up to the agenda that, yes, I would like to retain the right to make medical decisions for my minor children. There's been attack against parental consent for a lot of medical procedures under the Governor Polis administration, giving consent to minors for medical procedures for children as young as 12, with all of the liability, all of the risk falling on parents. And many parents are still not aware that that happened. So these were the issues that we were facing as a collective group of parents. And then, of course, COVID added all sorts of demographics to our supporters. So, we went from 3% of the population protecting exemption rights to COVID anywhere up to 30% of the general population now exerting an exemption right. And we see with the COVID vaccine, specifically for children, 70% of parents declined that vaccine.
Wow, that's incredible. Well, I apologize for not knowing that Colorado Health Choice Alliance has been around so long. I guess some bias on my part thinking that so much of this happened during the COVID years. And, it just seems like the world has changed so much since then that it seems like we're just in an entirely different place.
We are, and many parents are new to this issue. So don't apologize. This is a really timely topic for parents and everyone to understand their exemption rights.
Well, on the Colorado Health Choice Alliance website, it shows the mission of the group is protecting vaccine exemptions, promoting informed consent, and preserving medical privacy. Can you briefly touch on the importance of these issues?
Well, I think more and more people are aware of how important it is to protect exemptions, right? Medical freedom is everything. It's your right for your children to go to school in college. It's your right to, as an adult, to retain your employment and your licensure. It's your right to travel, right? To not be forced to show proof of you've had an influenza vaccine, for example, to get an airplane. I mean, medical freedom is affecting everything down to, can I potentially even get in the grocery store or have a financial transaction? So that one's not hard for people to understand. The other two parts, informed consent, is, and maybe more and more people are aware that they did not receive informed consent on these experimental emergency use authorized vaccines. They are not FDA approved, the ones that are currently on the market. That's the biggest part of informed consent. That was a bait and switch, that people think that they received an FDA approved drug. They did not. Maybe in the future, but currently all stockpiles are EUA. They're experimental. They have no liability. There's not even a product insert from the manufacturer that would explain the clinical trial, the contraindications. the adverse events. None of that information was presented as proper informed consent. In proper informed consent, it involves that discussion of the risk-benefit analysis. No one should have a coerced choice. That's not a choice. That's an oxymoron. And then privacy. This is where most people are not aware that there's a big industry that would love your medical information. And the whole COVID pandemic, contact tracing, vaccine passports, all of that is connected to data that wants to share your medical information to use it in like a surveillance state operation, where we're talking the goals of 2030, people 2030, healthy people 2030, are to take that data, your vaccine information and other information, and put it on real ID. So you would have to show proof of your compliance to travel, to work, to go to school. That is the end goal. So medical privacy is a very big part of this game.
Yeah, I think the medical privacy part that you mentioned there is something a lot of people neglect. A lot of people aren't aware of that there is this, panopticon surveillance state being built around this idea of big data. And really, when you tie it into digital ID and controlling every aspect of our lives, and of course, these little authoritarians thinking that they can make these choices for us based on the data that they get about how we live. It's so anti-American.
It is. Thankfully, more and more people, because of groups like yours, are becoming more aware of, protecting your data, not volunteering your personal information and taking, HIPAA is basically a permission slip to share your medical information with the government. And people think it's this big privacy protection. It's not. And FERPA says you cannot share a student's record without prior written parental consent out to any party, party entity, even the state. So that's why the legislation in recent years went after FERPA and created this state medical exemption to bypass FERPA, which was protecting all that student information. And that was the big last obstacle, which legislation in 2019, SB 163, was able to take over those student exemptions at the local level, at the local school, where they were private, they were not shared, only aggregate data that was needed for public health surveillance. But now all this personal information goes into a state database called the Colorado Immunization Information Service, a system that's it's CIS, we call it CIS, and you can look it up on the CDPH website, and that's something that I've been advocating for parents. You really need to opt out of that.
Well, speaking of students and parents, of course, many students across Colorado have recently sent their children back to schools. What do parents need to know about opting out of vaccines and vaccine tracking databases?
Thank you for asking that question. That is so timely right now. Okay, so two main things. There's opting out of vaccinations, and there's also opting out of this database. And then I would say probably a third thing that's really on my radar is opting out of these mental health surveys that are not really mental health surveys. So first, opting out of vaccinations. You can go to the CDPHE website, and in recent years, it has changed where there's a state form. Parents since 1978 were able to just write a letter to their school, either a philosophical or religious exemption, saying I exempt for one or all of the 72 vaccines on the schedule, or they could get a doctor's note saying the student is exempt from this one or all of the vaccines, and that stayed private at the local school, not in a database. And in recent years, it's changed to a state form, again, to bypass FERPA, that privacy protection. And so now that we have two categories of those three types of exemptions, medical and non-medical. And creating this non-medical exemption was, again, to erode some of our protected rights under the Religious Freedom Restoration Act, where this was a protected class, that we would not violate people's religious beliefs of any type, whether you're Christian, Jewish, pagan, vegan, all of these were protected classes for various things and accommodations. So now you go to the state has a form. And so you can take this form of medical exemption or non-medical, which includes those philosophical or religious exemptions in religious is not an institutional religious belief. It is a sincerely held personal belief to you, unique to the individual. And I'll probably go back and explain more of that. And you take that to a provider and you have them sign off. Well, in reality, we know because of other coercive tools with the medical licensing boards that doctors don't want to sign this form, right? They don't want to be liable. They don't want to hit a certain number of exemptions because then their license, their accreditation, their insurance network, all of these things are threatened by these metrics of how many exemptions they sign. There are many providers, including some nurse practitioners, who can sign these forms, and they do, but I am not going to put a target on them and say who they are, but they're out there. And don't go on social media asking who these people are. You have to really network with groups like yours and find out who signs these forms. So if you get in a situation where no one will sign this form, there's also what we call the re-education module. This is an educational module created by the state online, which tells you that there are no risks to vaccines. This is completely referenced by the CDC and CHOP, which is the facility in Philadelphia that aligns with the CDC, that says, here's all these terrible diseases in third world countries and some pictures. And you will certainly die if you don't receive all of these vaccines. You know, that's hyperbole, but not too far off. So, and then you sign that, not that you agree with the information, but that you were educated. And then there's, it currently says that, you know, your data is not collected in this module. That was the intent of the law and the statements of the sponsors of this bill, but it does collect your information, and that puts your information in this registry that I'm talking about, that is CIS, the Colorado Immunization Information System. It's a database, it's a registry. No good things come from registries historically. And long story short, then there's a whole separate process where you go through the CDPHE website and you opt yourself out of this database, so that what is retained in the secondary database, it's not a true opt-out, is not your vaccine information, but just some demographic information. I know that's complicated, it's a lot, but again, it's intended to be, right, that you have to jump through all those hoops.
Yeah, they try and make it very difficult, of course. I think, you know, you hit on some subjects that I think are really important. For one, in the past where parents had more control over over their children in terms of, hey, here's a letter, I'm the parent, I'm making the decision here. That's good enough, right? A letter should be good enough from the parent. Now the state has kind of over the years have usurped their role over the children and are doing everything they can to gain more and more control over parents' kids. I mean, we've seen it everywhere else, as you've said, with 12-year-olds being able to consent to these operation or, you know, medical procedures and so forth. So it's kind of interesting to see that this is along those same trend lines of the state taking control over students, over children, and really trying to push parents out and say, no, the state will decide, you know, that letter's not good enough anymore. It's up to us to to decide what's best for your child.
Well, and if I could just clarify on that minor consent, I'm hearing stories recently with back to school physicals and such that because we have minor consent, that parents are being told they cannot come into a doctor's appointment, they have to wait outside. That is absolutely not true. You find a new doctor, or the child can opt you back in. It might very well be that they have the legal right to consent in the state of Colorado, but they can override that doctor and say, I want that patient advocate, my mom, my dad, whoever, in this room with me. And in every scenario, whether you're in a clinic, a hospital, whatever age you are, it does not matter. If you're seeking medical care, you are not at your best. You are vulnerable. You probably don't have a medical degree. You need someone in there to go through the risk benefit of every medical decision, and you can opt that parent right back into the room.
No, that's very good information, very important to know. Yeah, it's very unfortunate what's happening in terms of, you know, the destruction of the family and parents, you know, their rights being violated on a daily basis, it seems.
And parents just need to be empowered that what their rights are, which is why this is such a great conversation of how we can be assertive and say, that's great. My child has the legal right. My child is opting me right back in here to be with them. Because let's just put it this way. Any doctor that says you can't have a witness in this room, red flag. Any hospital that says, you have someone in a potentially, life-ending situation and you can't have a family member advocating for you, red flag, right? Your wishes will not be honored. Your preferences will not be executed if you don't have a witness and someone who has a vested interest in your life and knows your history and your contraindications. If they're not in the room, then the best decisions cannot be made in medical practice.
Yeah, no, it's very important for people to know. And unfortunately, I think we saw that a lot during COVID as well, where people were separated, people who were suffering from an end of life situation and separated from their family. And who knows what happened to some of those people because they didn't have those advocates there that could have done things a little bit differently.
And the Colorado legislature bowed to the industry, the hospital associations. There was a bill in 2021 that said, hey, we recognize that people died alone and this was wrong. And we actually had 17 Democrats vote against having a patient advocate in the room, just one person in the room in the hospital. So what does that tell you? We have 17 lawmakers who are against you having a patient advocate with you in your moment of need, in your end stage of life. Like, this is appalling. So just know that they dug their heels in, they bowed to the medical industrial complex, and know your rights, and know your right to walk away and say, then we're leaving. We're going somewhere else to seek healthcare.
I think one of the most important things that individuals can do, or organizations, or people in the liberty community, is really trying to empower individuals. And I think that's so important with what you're doing in your organization, your articles, your radio work, everything that you do to empower citizens, individuals to understand the situation so they can be better informed and not be taken advantage of by this medical industrial complex.
And that's where these alleged mental health surveys come in. So you had a government that closed schools, knowing that there would be a disproportionate number of deaths of despair and a mental health crisis and economic destruction. And then the next year after lockdowns, all of a sudden there were, maybe 20 bills regarding mental health. We have to fix the mental health crisis, right? We have to fix the problem we created here in Colorado. And these mental health surveys, parents, they are not about mental health. They are about social emotional learning compliance, down to from the district to the school to the classroom to the individual level, are being graded using these tools. These are not evidence-based mental health screening tools. They do not screen out suicide. That's the emotional blackmail that is used to pitch these to the public and to fund them, that this will save lives. No, they're not even designed to do that. They're not even designed to be administered by a licensed mental health professional. These are third-party data collectors. The questions are completely inappropriate. Many of them are incriminating for crimes. Many of them are asking things that have nothing to do with mental health, but what your family values are. And who knows how this data will be used in the future. The example I point to, some of the questions are about drug use. Some of them are about if your family owns a gun, will this, and then if you're flagged for mental health, which is actually, anxiety, in the future, will your student be allowed to own a gun based on this data? Who knows how it will be used? It will not be used for good. If you have a mental health problem, I tell parents, opt out of these surveys, and there's no formal process. There's no state form. There's no school form. You can write a letter. I've shared some of those on the Colorado Health Choice Alliance Telegram channel, and we could send something out on email. There's just search, opt-out form examples online. And because these are data mining operations, and you just really need to know they're not, your child needs education time. They don't need more mental health surveys that will refer them to maybe providers that you don't agree with, mental health providers that you would not agree with, that don't align with your values, that are going to push referrals because they're very profitable for either drugs, counseling, gender transition. These are very nefarious. These are very Trojan horse, and they're using this mental health and suicide prevention as that emotional blackmail to get you to comply.
Wow. Wow. Yeah, so parents really need to be aware, it seems, that their student might be going to school, parent might be completely unaware that they're getting this mental health survey, don't think anything of it, and all of a sudden now the student's being referred to to psychiatric care or pharmaceuticals or some sort of counseling that now with this consent that the children have supposedly they can make decisions outside of the parent's purview, and all of a sudden before you know it your child's taking some sort of medications and these other things, or you're undergoing some sort of medical evaluations or counseling that the parents completely unaware. So it seems extremely nefarious. Any idea how prolific? Do you know how prolific these mental health surveys are? Is it in elementary schools? I mean, is this all over Colorado?
It is all of two of the surveys that have been in use for many, many years, and many parents don't become really aware of them until high school. The Healthy Kids Colorado, or some variation of those words. But this new one that's rolling out, the bill was so non-transparent that it wouldn't even tell you the name. They knew the name. They listed it in the fiscal note. It's called the BIMAS. BIMAS is not a mental health screening. It's not a suicide prevention screening. It is the cell compliance monitoring, and it's administered several times over the school year. Again, it's grading you on, do you align with these agendas, which most conservatives would not align with. And so just, sending a letter to the school in writing, getting confirmation that the school received it and put it in the file. My child will not participate in any type of mental health survey or any survey, because they will have various names as more and more parents opt out. But they are not mandatory. This new one is not mandatory this year, but that's just a foot in the door strategy, right? It's optional this year, schools, and then possibly next year, the future years, it's tied to some type of funding or accreditation. That's how these agendas work. So just write a letter saying I opt out of any type of survey, mental health or otherwise, for my student, for this year, for all years, forever.
That's a great idea. Yeah, no, thank you very much for sharing that. And hopefully I'll do my best to get the word out to any parents out there, anybody watching or listening, share that information with people to try and protect your children, because it's so unfortunate. I mean, almost every week there's another article about some scandal at a Colorado school, whether it's a teacher wanting to burn the place down, or some sort of abuse situation, or some sort of hidden agenda to hide things from parents and destroy information. It just seems so prolific. So it's good that this information is coming to light and parents are becoming more active and more aware to protect their children, because it's not the same schools that they went to when they were young.
It's really not. And it's kind of out of my, main focus, but I did recently attend the CPAN School Safety Summit. And a couple of things came out of that really hit me like a truck, is that a lot of times students are expelled from one school for having a gun or weapon or some really serious potential for violence, and they were transferred to another school without anyone in any of the parents being made aware, either one at the initial school that there was an act of violence, that a teacher was threatened with a weapon, and that the receiving school, that, hey, that student was just transferred to your school with this same potential for violence. So I really don't know how to guide parents there, but I would say if I had a child in public school, I'd probably be requesting the expulsion records, and I'd start having some serious conversations with the administrators that what is the system to notify parents that either an act of violence has occurred on our campus by an individual, don't have to name the name, or that we have received a student who has a history of violence in our school. I think that's a new layer of accountability, that as parents, that's not just going to the PTA meetings. That's next level what we're dealing with in our schools right now.
Yeah, I think, and there's this theme I've been seeing, and it's really about participation, for individuals, for citizens, for people to stand up, to get involved, to really start asking some questions, whether it's in schools, whether it's in city council or the state legislature. It's really going to take an active participation among the citizenry in order to, restore freedom and prevent any type of new tyranny that the government seems to be pushing every year.
Exactly. That is a great way to to really empower people, saying like, you need to participate in new ways that you never even thought you would. I mean, trust has been broken, and now we will act differently.
One of the most important lessons I think of 2020, and obviously it's been going on for years, but yeah, the trust isn't there anymore, and people need to act accordingly for sure.
And
Well, Pam,
definitely.
one of the biggest concerns in the liberty community right now is a return of a COVID style mandated shutdown of our society. Do you think Colorado will see another COVID shutdown?
Not just Colorado, every state, globally. I mean, if you look big picture, at what the World Health Organization is already in a year, they will declare that they are sovereign over all the nations with pandemic response. So they're already signaling, and I'm not saying that could be derailed without some good public advocacy and involvement. But if that is the intended goal, then they're already signaling that that is the goal, is to implement pandemic response, and not just for virus. Okay, I think, in my opinion, that public health emergency, public safety emergency, those are just the triggers for any type of climate lockdown, any type of virus lockdown, any type of gun control measure, election interference. Like, that's just the new scapegoat to override the Constitution. So yes, we will see another pandemic response repeatedly here in Colorado and across the nation.
I mean, that's I don't want to be depressing to people out there, but the reality is, it's not cheerful news, but like we were saying earlier, we got to confront these things. We can't, people can't just sit back and watch football and pretend it's not happening, because we've seen those disastrous effects of the COVID 2020 agenda, and it's only going to get worse unless people actually do something about it. So, like, my big question, and I've been asking this a lot around Colorado, but Pam, what do you think can be done to prevent another COVID shutdown?
Well, when you initially asked me this question, I sat down and I made this list of like these 7 failures of COVID. And I mean, if I had to pick one, I can touch on all 7 of them, but I think the citizen failure is the most empowering topic that I could talk about. So what we learned during COVID was that the majority of the people complied, right? So I would say 70% of people complied with most measures. And I mean, even with blatant violations of the Constitution and clear malfeasance, these regulatory agencies were clearly incompetent. Our public health, recommending pseudoscience and all of it, right? So the lesson learned is that you cannot comply your way out of tyranny. There must be a form of civil disobedience, and there are people I know who don't have that kind of muscle, right? They know truth, they see corruption, but they just haven't had to build this muscle. So a couple of the tools I would say to citizens to build this muscle, to keep your government accountable. 2 things kept coming up when I would talk to people about their rights and asserting their rights. One is a Religious Freedom Restoration Act of 1993. And so many people would say to me, but Pam, I'm not religious, and I can't file for a religious accommodation. This came up with my military people a lot. And if you really dig into the Religious Freedom Restoration Act of 1993, it's a sincerely held belief. It is not an institutional religious belief. So, for example, let's say you want to object to this new technology, this new vaccine, mRNA, based on your beliefs about the creator and your objections to aborted fetal cells. But your church or there's no institution that has objected to this in their doctrine. That's fine, because it only requires a sincerely held belief. And for you to submit some type of religious accommodation or exemption, you only need to provide your sincerely held beliefs, that you have an objection for various reasons based on your personal religion. And you can become more religious at any point in your life. If you've been, and this is all I'm referring back to case law that's been supported in our courts, is that you could be non-religious your entire life, non-spiritual not a part of an organized religion, and then suddenly decide either one, now I am religious. That's fine. That's been supported by case law. Or I'm more religious. I want to be more, maybe in the past that I was okay with some of these ingredients or products, programs, but now I'm not, because I want, I just have a stricter adherence to my beliefs. And all of those things have been supported in case law. And then the other main area that I feel was a major win for me personally and people I, helped was our Disability Act, the American Disability Act of 1990. And again, you don't have to have a disability to claim a public accommodation. So this is where some of these HR lawyers got COVID wrong, right? So some of these HR lawyers advise people that you can have a vaccine accommodation or an exemption, but now you have to work from home. That is not an application of the American Disability Act, which says the public accommodations are to bring people into public spaces. Like everyone's familiar with this for, let's say, wheelchair ramps, right? That was to bring people with physical disabilities into public spaces, into the workplace, very simple accommodations. Same thing with the COVID vaccine, that an accommodation isn't, okay, we'll let you keep your job, but now you have to work from home, right? That's not bringing people into public places. Or let's use the example where I won the right to go to my local rec center. And again, I didn't have to take this to court. It's that powerful where someone says, hey, you cannot come in here in this facility unless you wear a mask. And then I say, well, actually, the American Disabilities Act says you have to provide a public accommodation. And let's talk about what that looks like. And this was such a mess. Just thinking about it, it's kind of humorous where I was negotiating with, so one person, it turned out, at the county public health, Tri-County Public Health, was making all these bizarro rules. And then so when I pushed back with ADA, she said, well, you're right. We do have to include you in public places. And so I guess we'll require that the local rec center provide you your own swimming pool. I mean, I'm not exaggerating. And because I understand it, I said, actually, no, that's not how it works. You can't put that type of burden on what is essentially a small business. But you can provide special hours where people who can't wear a mask can come into the facilities. You can provide a special portion of the facility for people who can't wear a mask. So those are the two areas I would point people to. We won a lot of battles over public accommodation, and no lawyers were involved, just explaining to people what it means and what they're obligated to. And that's how you present these problems. And strategically, you go into a situation like that and you say, hey, let me help you, right? Let's find the win-win here. I know you want me to use your facility. I've been using this facility for a decade. I know you want other members of the community to come in here. You don't want to turn people away because one lady at the county health department is making up bizarro, rules based on hysteria that are not, legally binding. Let's work this out and figure it out. And so when you just educate people on these two areas, what has been established in our statutes for religious freedom and for public accommodation under ADA, a lot of those battles will be won under those two laws.
Oh, yeah, that's a very powerful information. And I think it's so important. That was obviously huge concerns during 2020 is what do you do? What do you do about this and being prepared for the next time and really having that information at hand and understand your rights, like we were talking about empowering individuals to understand your rights, be prepared, understand, what you can do under these different government laws, basically. So you talked a little bit about civil disobedience as well. And, I think, it seems to me that mass noncompliance is one of the best strategies to defeat government mandates. Do you have any thoughts on a strategy for mass noncompliance, how to get people organized?
So you really have to be in these scenarios when you're talking about civil disobedience, you have to decide what kind of person you are. You have to decide, am I vocal or am I not? And both are fine. But I'll give a good example and a bad example of where your tribe really comes into play in these scenarios. So first of all, being vocal or non-vocal. So you can either say there's a facility that's asking people to wear a mask or do some type of like temperature check or health screening, you can say nothing. You can walk right past them, right? You can just keep on walking. And I would say, personally, what I experienced, that works. No one challenges me, right? I'm walking in, I'm like, I don't even make eye contact. I'm just going to point B. And if you are confronted, you can simply say, I opt out. And for most scenarios, that works, right? Whether it was someone trying to put a temperature reader on my forehead, I opt out. Oh, okay, no problem, right? So they're not going to tell you have the right to opt out and then go on with your day. That works for so many things in society. I would say, not just for COVID. Again, if you're thinking the future, we're talking about those body scanners at the airport or facial recognition. No one is going to tell you you can opt out. And there's probably some really easy procedure, quick and easy procedure for you when you opt out. And so, but then let's talk about a couple examples where your tribe really comes into play. So there was one situation where it escalated for me during COVID, where I walked right past the little mask guard at Sprouts. And on that particular day, apparently we had invented this new color wheel where we were in red. And this is total pseudoscience. There's no data behind the color wheel, and we need to challenge that. But I didn't know we had turned to red. And so, because nothing had changed, and I went into Sprouts, walked past the door guard, per my normal without my mask on. But then she sent the manager. I guess they had been warned, like, hey, we're in red now, so let's get serious. So manager approaches me and says, hey, you're not wearing a mask. You need to leave. I said, no, I'm picking up 3 things and then I'll be done. And I went to check out. And as I walked over to check out, the manager said, hey, I'm going to call the sheriff. And I said, do it. Right. I know that I'm not in violation of any laws or, local codes or whatever. This is all pseudo policy. There's no law or statute, or, when they say it's the law, it's not the law. So while I'm in line, I'm holding the whole line hostage now because they won't let me check out because they're waiting on the sheriff. And so I take that time to educate people in line behind me. I tell them, these people in my community, what is going on, that I have a child with a disability. He needs to see my face to communicate. And you can't see that type of disability. And it's really no one's business. And when I approached the register, the cashier said, hey, you need to cover your face. And I'm not in the business of putting people who are fearful into more fear. So I took my shirt and I covered my face, and I was ready to conduct this transaction. She said, no, it needs to be a mask. So I said, that's not happening. And so I'm explaining to the people behind me what is going on, that the sheriff is coming, and that I just want to pay for my groceries and leave. And this is not right. And I've shopped here before many times without a mask and whatever. I'm just going off on this like monologue in Sprouts. And to my disappointment, no one in that line said, just let her pay for her groceries, right? Like, no one stood up, no one spoke out. It was just this really disappointing moment in humanity where I thought, really? Like, and it was mostly men, and they were all wearing their masks. They were all waiting 6 feet apart. And, I was like, really? No one's going to say, because the whole point of this story is that I think if just one person would have said, just let her pay for her groceries, not only would I purchase my groceries and left, rightfully so, a legal transaction, but I think it could have really ended what was going on at Sprouts. I have no problem throwing Sprouts under the bus, by the way. So the sheriff came. The sheriff was like, hey, I'm just here to keep the peace. Like, I'm not arresting this lady. And we had a great conversation about the manager was unhinged. And this really infuriated the manager. The manager really wanted to make an example out of me. She wanted compliance, and she didn't get it. So now she's angry with the sheriff, right? That the sheriff's not arresting me. We're having this great conversation about, the color wheel and going red and all the calls. There clearly was a script. When we went red, start calling the sheriff, right? That the public was not aware of. So that's my bad example of that was an opportunity lost, where just one person, all they had to say is like, hey, just let her pay for her groceries, right? Like, come on. just the voice of reason. But a good example, the flip side, is that one time I was at the Denver airport. I was coming off the train. I had returned from this glorious freedom in a red state at the beach where no one cared about COVID or masks or pseudoscience and total freedom, and walked right back into Denver, with Denver's policies. There was a mask mandate in the library. Coming off the train into the escalator, I was confronted by a woman who was very hostile and very aggressive, and told me that I wasn't wearing a mask and I was putting people at risk. And my intention was just to inform her that she was not the mask police, and then I was, going to keep walking and go home. And she blocked my path, and so I had a verbal warning of 6 feet. You need to give me 6 feet, right? I'm going to use their whole strategy against them. And then she continued to aggress and get in my face. And again, if I have some type of lethal pathogen coming out of my nose and mouth, it makes no sense that someone would get closer to me and get in my face. They should walk away. So the second verbal warning was, hey, I'm a veteran. I will defend myself. And now I feel like the crowd is aware of what is about to happen. You can see it in people's body language. They're watching. They're backing off because this lady is super aggressive, and she's not reading room, right? That, hey, I'm not saying that I'm exempt from anything because I'm a veteran. I'm saying that you're really hostile and things are about to escalate. And so what she doesn't know is that right behind me, my 4 besties are coming off that escalator right behind me. And I can't see them because I'm focused on crazy lady. But I feel a shift in the room, right? That now I have 4 people right behind me that have my back, and they're going to make sure that, that I'm safe. And she, all of a sudden, the energy shifts. She walks away defeated, right? And so none of them said a word, but they were there. They were present. They were supporting, my rights to exercise in that situation. So I just use those as 2 little examples of the power of just being present and being supportive, and sometimes just maybe being vocal, just speaking up. And again, these are unprecedented times, and people really didn't have something to fall back on in their lives to know what to do. But really kind of put yourself in these situations again and say, what would I do differently, not only for myself, but for that other person who is willing to be vocal and fight these battles? How can I support them?
Wow. Yeah, very powerful stories. It was so unfortunate, like you said, to see how easy so many people just went along with the whole compliance mandates and just doing what they were told. But how empowering it is as well, just to have a couple people, 4 or 5 people, a dozen people stand up, not go along with it, and all of a sudden, you got the majority there. So pretty empowering stories, but also a good lesson from 2020. And I really hope that going forward, there's more individuals who are willing to speak up, to stand up, to get involved and not let this happen again, because we saw where it leads. It doesn't lead anywhere good. That's for sure. I think obviously we're still living in the shadow of 2020 with the mental health crisis, as we were talking about, the record crime, the abuse situations, the drug use. So many people are pushed over the edge, and I worry if it happens again, or if they get away with it again, what that'll do. I mean, the final death nail in the coffin of civil society, it seems, could be very possible.
Exactly. I could address any of those other areas where, the testing, the hospitals, public health failure, medical practice failure, government failure. Whatever we would want to talk about. I could give examples of strategies that people could interact differently with those institutions.
I guess one of the big ones I'd have is testing, because that would be the first step. If they did try and do something, you'd be, hey, you got to get tested. You got to go through the testing process, and they would use that as kind of the initial step, in my mind, at least, to get us back into some sort of situation like they had previously.
Well, testing is a great topic because, so first of all, what we don't do is educate people on who is susceptible in a cold and flu season. We know, we have decades of research. We know people who are vitamin D deficient are susceptible to cold and flu. So did we roll out a massive vitamin D testing? Vitamin D is simple blood test. It's inexpensive, and say, hey, this is the number one risk factor for cold and flu type respiratory viruses from October to March, cold and flu season. And why is that cold and flu season in our hemisphere? It's because less sunlight, temperatures are dropping, people are indoors more, they're not getting enough sunlight. Even in my case, so last year I measured my vitamin D in September. And just from that September to October timeframe, I went down 25 points in vitamin D. And I'm outside every day. The lifestyle I live requires that. But there's just not enough sunlight and intensity of sunlight in being outside at that time of year. So you're dropping yourself now into a low vitamin D status. You're not feeling any different. You haven't changed your routine. It's just the nature of the season. But we did not educate people on vitamin D, and that it was the number one risk factor. And along with that, people with susceptibilities such as obesity do not maintain good vitamin D levels because of fat cells. People with high inflammation like diabetes tend to have low vitamin D, and people with high melanin and darker skinned people don't process vitamin D, and they're all at risk. But did we educate the public on low vitamin D? No, we did not. So, I would say a couple of ways to go about this is, instead of a PCR test, which is a reactive, right, and filled with false positives, it doesn't distinguish between influenza or any SARS-CoV-2 or any virus, right? It's just a flawed test inherently. And the CDC has recognized that. Not very publicly, but if you dig, you'll find it. If you follow the CDC like I do. So advocating for yourself to say, hey, whether whatever world you're in, whether with your employer or with public health, saying, why don't we check everyone's vitamin D? That's how we're going to save some lives. That's a proactive move to get us back on track. And as far as the legality of these PCR tests, I mean, if they're under emergency use authorization, which they were during COVID, they're completely voluntary. They're not FDA approved. So you can say, again, those magic words, I'm opting out. And go check your vitamin D so you don't live in fear, that you can say, hey, I can do something about this. I can take a simple vitamin D supplement, or get outside, get more sunshine and exercise, which is the opposite of lockdowns and isolation in your home, and mitigate your vitamin D. And I mean, that's the big picture, is that the opportunity cost was that vitamin D is very inexpensive, and PCR tests were very profitable with millions of dollars in contracts. And there were some scandals here in Colorado with how those contracts were awarded. And that made the news in my world. And so just understanding that you don't have to live in fear. You can monitor your vitamin D, and it is natural to have these decreases during cold and flu season. But just getting your vitamin D in a healthy level is going to mitigate your severe risk.
Awesome. No, that's so important, especially, this time of year, especially. Well, Pam, I really appreciate your time today. Really thankful for all the hard work you've done over the years. And I'm sure your voice is going to be very valuable to continue into the future, as we see the government not give up their tyrannical schemes there. Is there any final parting words you'd like to give the audience here?
Oh, there's so many things I could say. As far as going into another cold and flu season, people really do need those patient advocates. We know from the United Kingdom that the potential for lethal injections, there's evidence of that. So I know that's a dark note to end on, but that we're talking about maybe putting in writing in a medical directive for, if you have someone in a nursing home or care facility, hospice, anyone in those at-risk elderly groups, that they should know that the United Kingdom prescription database says that these prescriptions for midazolam, which is a sedative that was used for seniors, the prescriptions doubled during COVID that first year, over doubled, over 50% increase, and those can be fatal. And so we won't know for a few more years, like, were those truly people who died of COVID, or died of this, we're going to give this lethal injection to everyone with anxiety for COVID. And so I would say put some medical directives in writing if you have someone in a care facility that those people are my heart, those seniors, but also these young students, how to advocate for your students and their mental health. And that is what was lacking. When you go to the local level and you advocate for schools to stay open and businesses to stay open, you need to ask for the risk assessment, the counterbalance to economic destruction, mental health crisis that was imposed on our young people, especially those 18 to 24-year-olds. What are the counterbalancers? There's always a worst case scenario, a best case scenario, and a do nothing, right? Like Sweden. Sweden is the ultimate example of we're doing nothing for our young people who are not at risk. They have a 99% survival rate, right? So that is always on the table. That is always an option. COVID is an example of groupthink, where we're only using the CDC data and we are doing the worst case scenario option without any counterbalance for destruction on all other aspects of society. So I think those are some of those key populations that we need to protect: our elderly and our students. And who is best qualified to conduct that advocacy? People in our age group, right? Like you said at the very beginning, that this is a time, an era where we need to participate at the local level. I'm a big advocate for get local, get vocal, because the battles are not in Washington, D.C. I could also argue they're not at our state capitol. You're not going to win a lot of battles there, but they are winnable at the local level. Your local government has the power to say, we're going to pass some resolutions that you cannot discriminate based on your compliance to a vaccine, to a public health policy. And if you run your business that's discriminatory, we'll revoke your license. I mean, so we really need to start using these local tools.
Yes, definitely. Empowering people at the local level, I think, is so important. People getting involved in their city council, county commission. I mean, some of these special districts, whether it's a recreation district, just to have a voice and get good liberty-minded individuals elected and getting organized at that local level. I think one of the key factors is find the other people, find the other ones out there who agree with you, who think the same way, and be prepared. Just have a community group where you're meeting and able to understand who's on your city council and how you can have a voice, how you can influence their behavior. And when they're up for re-elections, you can hold them accountable if they decide to try and violate the rights of the people in the community.
I could not have said it better. That is like the best summary. That's exactly what people need to do. And when you do get involved, you're gonna meet like those four besties that came up behind me on that escalator. Those are the type of people you're gonna meet. Those people who are gonna have your back and wherever you are. So that's the key. Find your tribe. And I think Colorado Free and Open, that's an excellent tribe to be involved with. I'm a super fan.
Oh, they're great. Definitely trying to attend any of those events that keep Colorado free and open that Julie and Sabrina have been working on for years now. I think that what they do, and you and everybody else out there too, one of the most inspiring things for me during the COVID time was seeing all these pockets of resistance pop up, realizing how many people in the community were looking for their tribe. We're all of a sudden getting involved and showing up, and whether it was meeting at a coffee shop in Erie or a church out in Brighton, or a church up in Loveland, for example. But just all around, there's these little groups popping up of individuals saying something's not right here, something's wrong, and who else is noticing this? And then that's the first step, getting together, getting organized, coming up with a plan, and really understanding your rights and understanding your ability at that local level to have a voice. So I want to leave people with that inspiring idea, inspiring message that they're out there. You're not alone. And I think as things continue, there's more and more people kind of waking up to the sinister agenda of our government in so many ways, and get organized, find the others. And if we get together and do that now, we can prevent some of the worst things from happening, I think.
Well said.
Well, Pam, how can people support your work?
Well, really, I'm just a resource for people and an encouragement. I hope that there's information, there's tools. So I'm with Colorado Health Choice Alliance. We have a website, and I'm with Children's Health Defense. I really spent most of my time during COVID advocating for our military. And why that's super important to me is that I knew that they would be the first ones under some type of a legal mandate. They were the front lines, and everything that would happen in the military would spill over to the civilian population, which is exactly what happened. And so I'm still working with them. And I guess I could break the news here today for the, breaking news is that Children's Health Defense is launching a military chapter. It's like some of their state chapters, and I'm a big part of that team. And that is in the next month. So that is just breaking news right here on your podcast. And I'm working on school board candidates. If you want to affect the culture for the next generation at the most direct, lowest level, it's with those school boards. And I don't have children in school anymore, but mine have gone through college and beyond. But I care about that next generation. So I would say, follow your school board candidates. They don't have an R or D next to their name, so they need help getting the word out of who to vote for. It's less than 10% of people vote in school board elections because they just don't know who to vote for. They don't know who aligns with their values. So do the work. And I'm helping some of those conservative candidates make a difference in their communities.
Awesome. Well, wonderful. Well, I'll link to your website or Colorado Health Choice Alliance, your articles for Children's Health Defense, and link everything there at freestatecolorado.com for anybody watching. But thank you so much, Pam. I really appreciate your time, and I hope to talk to you again sometime soon.
Certainly. Thank you so much.